So I'm using the handlebar tool, so one of the tools which is designed for kind of putting a bit more pressure in bigger areas, but I'm being very gentle with the way I'm using it because I'm working obviously in quite delicate areas. So this is something which is quite important. Whenever you use these tools, you need to know how to use them properly, because you can do quite a bit of damage if you're not using them in the right way. They can create a lot of force in the tissues. Is this pressure okay?
Yeah, fine.
Good. So we're coming in and around here, also down in towards the mastoid as well. We've got the attachments of all of the lateral musculature of the neck. Okay. And very rarely do I use a handlebar tool to get deep into the suboccipitals, but in this case, it's exactly what's needed. Feel okay?
Yeah, it's fine. You feel it's working already, can't you? Things slowly cracking again, isn't it?
Yeah. You can see as well the tissue's kind of gone quite a bit red, but again, everything's based on each individual case, and this is quite normal.
It don't stay red though, does it?
No, it doesn't. No. But it shows that obviously it's having this huge increase in blood circulation and things with what we're doing. It opens up lots of mechanisms of healing. Okay, I want you to tilt the head slightly and just tilt there. Sometimes when I'm working, especially with the tools, just relax for me, not tensing up just there. What I want to do is I want to sometimes create a line of tension in the areas that I'm working with, so I'll get the tissues to kind of stretch out a little bit. You can notice that we're not using so much movement in this case. Sometimes we use active movement when we're using the tools, and again, in some cases we don't. And again, it's based on the objectives of the treatment and what we're trying to do. So in this case, we're really just trying to get some of the tissues to loosen up. And maybe as we progress, we may start using some movement within the sessions in terms of active movement with the Graston technique. But at the moment, we're just working on loosening things up. But I feel like I can really get into your neck so much better than when we first started.
You wouldn't have had to do none of this, would you?
Yeah, exactly. It was just so stiff and everything was just so kind of locked up.